Um, Hi, everybody. My name is Supriya Kotra Prabhakar. Welcome back to the session on Health Insurance Information Platform. We will continue our discussion on the same topic and focus on the health claims platform and understand the benefits of implementing e-objects. So, as we discussed in the last session, the e-claim objects were designed to serve as a digital solution to the manually cumbersome process of entering multiple fields in the existing claim and reimbursement forms. The manual forms lack defined values and data sets. So, in simple terms, the e-claim objects are digitization of the familiar paper-based claim forms to formats that use data elements with defined structure and semantics. These e-claim objects capture minimum required information, which is essential for processing a claim transaction submitted or requested by a payer or a provider. The electronic claim objects will have standard value sets that will facilitate common language across payers and providers with a structured coded value inputs. The data input captured using the e-claim objects will be machine readable by the claim adjudication processor and the claim switch using the standard open APIs. Okay, so this is like what happened in the fintech revolution when government of India created the unified payments interface, the UPI platform, and then created the BHIM app and released the related APIs to the market. And later, what happened is that the market used these APIs and built these well-known and hugely successful payment wallets like Paytm, Google Pay, PhonePe, etc. And in about 3 years' time, the UPI transactions went from negligible to about 1 million transactions per month. So that is something that we expect, something similar that is what we expect to see when the e-objects will get adopted. As we discussed, e-objects are completely machine readable and interoperable, which means that any provider that has its own software solution need not match the solution with the insurance provider or with the healthcare provider. They can continue to use their own solution, but with the implementation of e-objects, they would be able to transmit information between each other without uh, any without they'll be able to transmit information between each other seamlessly. Usage of these standard e-claim related objects will facilitate auto adjudication of claims by both the public and private health insurance players with reduced operational costs, and that's going to bring down the as it reduces the cost by a large amount. It also reduces the time that the claims processing has been taking currently. As there are no applications that are currently able to produce e-objects as an output, the NHA is trying to provide three options to both payer and the provider. Can we just can we move to the slide? Yeah. Yes, please. Thanks. So let me just back up a little bit. There are no applications at the moment that are able to provide e-objects as an output. And so NHA is trying to provide three options to both the payer and the provider. And it allows hospitals to choose a software that can help process any insurance claim and get end-to-end visibility of a claim status till payment is made. And the hospitals have three choices: either procure a solution, specialized software, or use free software from the government, or modify their existing HIS system to support the APIs. The model that you see here on your screen allows to create a market where insurers or TPAs can choose software that will help them improve on the adjudication, fraud, or abuse prevention. It will also allow to create the health claims platform that validates requests, routes to appropriate parties, guarantees payment, and gathers data for real-time monitoring. Can we move to the next slide, please? So the health claims platform is intended to improve the current claim processes, enforce transparency, and facilitate on-time provider payments for the health insurance claims. The eClaim objects will facilitate this flow of data exchange between the payer and the provider, help in claim submission, processing, approvals or rejection of the claims, in provider payments, end-to-end in the health claim life cycle. That's what you see here on your screen. So as I mentioned earlier, that there are no applications in the market that are currently able to produce e-objects as an output. The market is beginning to gain maturity and to be able to support vendors to create off-the-shelf solutions that use e-objects for data exchange. That ecosystem will mimic the revolution that happened in the fintech space with the introduction of the Unified Payment Interface, the UPI platform. But in the meanwhile, NHA has come forward to provide a free transaction management system for both the payer and the provider. So it's going to be a TMS payer and a TMS provider that shall facilitate generation and consumption of these e-objects. And the common health claim platform, designed on the principles of open APIs, will be utilized for the electronic exchange of these e-claim objects between the payers and the providers. So we don't really need to wait for the market to mature and create all these off-the-shelf applications, but the payers and providers can start using the TMS solution and start adopting the e-objects. So what we're going to have is the provider transaction management system, which is nothing but a software solution that will be used by an empaneled hospital to generate the required e-objects that will be transmitted using the common health claims platform. And we will also have a payer transaction management system, which is nothing but a software solution that will be used by a payer, an insurance provider, to receive the provider submitted e-claim object, and it has the ability to create the relevant response objects, and that will be transmitted again using the the health claim platform, which acts as a router. So every e-claim object that is generated either by the provider TMS or the payer TMS will have a unique identifier, so that it can enable audit logging and audit trails. The health claims platform will only read the header part of the e-claim object, and the detailed part that may contain some sort of a protected health and financial information will stay encrypted and will only be accessible by the payer or the provider who it is intended for. Then the successful routing of the e-claim objects, for that the health claim platform will always validate the header for certain errors or missing information, so using certain rules that have been put in within the health claims platform, so that there are no mistakes made in terms of who it's going to and who it's coming from. And the health claim platform will always maintain the audit trail of each and every transaction that was made during the entire claims life cycle. So this kind of explains to you how the health claim platform is going to function and what are the most important things that will be taken care by the health claims platform. The health claim platform will also support routing of these relevant e-objects that will be created at various instances during the claims processing. And these are the e-claim objects that we saw in the last session. They are the coverage eligibility request and response object, the pre-authorization request and response object, claim request and response object, payment notice and payment reconciliation e-object. Can we move to the next slide, please? Okay, so here the workflow can be visualized in this format. The green colored blocks that you see here are the current existing processes, and the orange blocks are the new electronic processes. And the workflow would begin with the coverage eligibility check um, initiated by the healthcare provider, where the hospital requests the payer or the insurance provider for an eligibility check on the patient for a specific treatment or a procedure, and the payer comes back with a response saying whether the patient is eligible for it or not. And then you have the digital and automated payer provider contract management. This is with respect to all the tariff related contract information that will be stored in the contract management part of the solution, which will be used to come up with the estimate for the entire the planned treatment. And after this, you have the pre-authorization process, which has the pre-authorization request, response, and any enhancements. So this is where the provider would send the patient's information, details of the planned procedure, the estimate amount for the procedure, along with all the supporting evidence explaining why this particular procedure is needed and why this was advised by the doctor, with all the tests and all the required information. Following that is the final, the claim information update, claim or pre-authorization information update. That's when there are more back and forth queries required between the payer and the provider in case there is more information that is sought. Then you have the claims request and the response, where again the final bill is ready. The patient has been administered the treatment, and the patient is now ready to be discharged. Then the final claim needs to be request needs to be sent to the payer, and this response and this request and response are exchanged between the payer and the provider, along with the pre-auth details, the actual procedure, the tests that were done, the discharge summary, and everything related to that particular encounter. All this information is sent using these claim request and response objects. Finally, when the payment is to be made, these are the three objects that will be shared. The payment notice, payment file creation would be done, then the payment reconciliation based on any enhancements or any changes in the amount that was paid. Can we move to the next slide? Okay. So this slide also shows you the generation of the request and response objects during this workflow in the order that they are getting generated. So what you see here is a segregation of how the payer side processes happen and the provider side processes happen. And then you have the health claims platform, which is the mid layer, which acts as a router here. So everything starts with the policy, the package configuration, which is the first step. And this is also a new electronic process that's going to be introduced. And then you have the coverage eligibility check getting initiated from the payer side. That's when the request object is getting created. Similarly, in response to the request object, you have the response object coming in from the payer side. So you could follow that with the numbers on the screen. So after the response object is received, then the provider starts initiates the pre-authorization request. So similarly, all of this these steps will continue as we saw, and the request and response objects get created at specific instances during this entire claims processing. And this ends with the payment notice and the payment reconciliation, which is the last step, and that would be when the claim processing is completed. Yeah, can we move to the next slide, please? Okay. So here are the advantages of using the electronic claim objects, both from an operational and technology perspective. Operationally, what would happen is the e-objects are advantages because they bring in a lot of structure and machine readable data, so there is less chances of errors, and it's more structured, so it can be handled better. Then you have faster and effective claim processing because these are machine readable, so you can put in a system, you can put in a rule engine within the your solution, and you can automate a lot of processes. So automation would bring in a lot of cost efficiency, and that would also mean that the number of people required to do these claims processing would reduce drastically, which has been seen in multiple cases. And in case studies, you can see that how RPA, which is robotic process automation, allows for cost effectiveness, and the number of people required to run the adjudication process is drastically reduced while when you use automated systems. And e-objects will also bring in common structure and meaning across the health insurance industry, thus bringing down the level of subjectivity and keeping it more generic and more universal across the health insurance industry. And this also provides freedom for both the payer and the provider to choose solutions that can use that have adopted the e-objects for claim submission or processing or any of these aspects. So it gives a lot of freedom to the providers and the payers. And as this requires minimum, it also carries minimum amount of information that the claims processing engine would require to process the claim. So it's going to be faster, and it would do that in a way that would not require much of back and forth or looking into any other attachments or asking for more information, because the minimum required information that has been chosen to be part of the detailed body of an e-object is well defined and would in most of the cases be enough for adjudication of the claim. Technology wise, this is going to be advantages because it brings in interoperability, also because it is based on FHIR based resources. So in terms of FHIR, I'd just like to give you a small introduction or a definition of what FHIR is. FHIR is nothing but a fast healthcare interoperability resource. This is basically an interoperability standard for exchange of electronic exchange of healthcare information. This standard has been developed by the HL7 Health Level 7 International. It is a not-for-profit organization, and it develops the organization develops and provides frameworks and standards for sharing electronic health data. So I don't want to get into the details of the FHIR standards at the moment, but because the eClaim objects are based on the FHIR resources, it brings in a great deal of interoperability. And there is metadata standards that are used for semantic interoperability, and these are they are highly secure and allows for a and the health claim platform is ensuring that there is a high secure and encrypted information that is transacted between the two entities. And these are lightweight again in terms of resources that will be used to process these packets of data. They're machine readable again, so there can be an AI engine that can be plugged in, a rule engine that can be plugged in that can help in fraud alert management and all of this. So, okay, can we move to the next slide, please? Okay. We've looked at the perspective of, I mean, in terms of operations and technology, but in terms of the users, the provider, payer, and the patient. So you have three perspectives that one could look at it from. And from the provider perspective, why the e-claim objects and the health claim platform would be advantageous or helpful is that from a hospital admin's perspective, what would happen is that it would result in faster turnaround times, faster payments, and hassle free paperless claims. So it's going to reduce a lot of wait times, and this would also allow patients to get discharged quickly, because we've always seen that when a patient is ready to be discharged, the insurance process is what takes them almost a day in some cases, and delays the discharge of the patient, and then you see the bed being blocked for much longer than it's required, and that sets in a lot of adds a lot of cost. And from a specialist or a doctor's perspective, what this would do is it allows for faster payments and more referrals that can be facilitated using this technology platform. And from a state health officials' perspective, what advantages would they get from this is that it gives them information about the disease burden of a specific district that of interest. If they're looking for what is happening with a specific district residents or information on a specific district, it can give you information on that. It can also give you information on what uh, so that the health officials are able to come up with interventions that can be used to address certain concerns, like introducing screenings or any such things. Can we move to the next slide, please? Okay. And most importantly, from the insurance perspective, though this is a very focused solution for the insurance payers, it is only going to be possible if the providers adopt it. So, though the benefit seems to be more for the insurance companies, it is only going to be possible if the providers adopt the solution. So, I think the importance lies in the provider adoption as much as the payers adopting the solution. So, for the payers, this would result in about 80% of hassle free paperless claims, which can also enable automation, auto adjudication of the claims, and this could also result in less chances of frauds. And you've also seen, we also spoke about robotic process automation. Having the rule engine and having machine readable data allows for automation to be introduced, and this would reduce a lot of time and effort and cost. So especially for the insurance providers, this is going to be extremely beneficial and faster, and would reduce the turnaround time by a huge margin. And can we move to the next slide? Yeah. Finally, but not the least, from the patient's perspective, what does the patient benefit out of all of this? It provides access to more empaneled hospitals, more specialist options, and preferred treatment given by specific hospitals, and you could have medical records in digital lockers, etc. So with the e-objects, what's going to happen for the patient is that with more hospitals and more insurers adopting this would allow faster claims to happen, patients getting access to multiple different hospitals that they can visit, and uh, so in that way you're enabling patients to better healthcare and more options in terms of getting specialist kind of access, and yeah, the electronic records can in the future, medical records can be finally created, and that can become a reality if we start adopting these standards. So next slide, please. So yes, this, I think we've covered a lot of perspectives in terms of the users, the stakeholders. We've seen the use of e-objects, the reason for introducing them, the health claims platform that has been introduced with a specific intention, and why it's been introduced, and how this is going to really help both the entities, the payers and the providers, and how e-objects are going to bring in the level of interoperability. So I'm sure you're able to appreciate the reason for the introduction of this design and the concept, and are able to understand how a health insurance information platform can be envisaged. So I'd like to pause here and check with Dr. Pankaj if he would like to add anything.
So, Supriya, you've covered pretty much everything. Nothing really that needs to be added. But only point that I would like to stress upon is the financial lever. So this is what we always say the financial lever is, and this huge change that is coming from the health insurance perspective is something that is unheard of in India so far. Now, if you look at the entire healthcare models globally, there are two kinds of models, or two ends of the spectrum. One end of the spectrum is the US model, which is completely privately owned, privately run, privately funded. Government plays a very small part in that, which is basically Medicare, Medicaid. And on the other end of the spectrum is a UK model, which is completely government funded, government run, government owned model. So we are somewhere in the middle in India, which is, so far it's been out of pocket, more about 80% out of pocket expenses. And the health insurance, the private health insurance has been about 3% of India's population. Government health insurance, everything put together, central government, state government, and the various schemes that you have, ESI, CGHS, etc. Everything put together is about 10%. So that's about 13%. But now with coming in of the Ayushman Bharat, we are likely to cross the 53% mark of India's population. So health insurance consolidation is happening. And because of this health insurance consolidation, the number of claims are likely to go up by at least 10 times. Now, those many humans are not available to do the claim adjudication. Those many humans are not available to do the claim management and the entire process. So as a country, we have no choice. We have to go digital. That is one thing. The second thing is, if such a big change happens on the health insurance side, then the payer gets a power in terms of directing the provider sector to in terms of what are the standards that they require, because if they have to process the claim faster, then they have to put the claims in a standard format. So they're going to be demanding standards. So those are the standards that we've already talked about: the National Digital Health Blueprint, etc., etc. So that is definitely going to happen, and it is inevitable change because of the health insurance consolidation that is happening. We're moving towards a universal health coverage model, and it's actually advantageous for everybody, because pay out of pocket is not a very good model to have in this country. There are about 2% of India's population that falls below the poverty line every year just because of healthcare expenses. And in pandemic, we've seen that it has shot up through the sky. A lot of people have not been able to afford the hospital expenses that were that had to be incurred. So that has happened a lot in the pandemic, and this is not a good situation to be in as a country. So we have to move away from that. We have to move into the health insurance model. We have to move into a universal health coverage model, and hence the change. So that is what this entire lecture has been all about, and just wanted to sort of let you know that this is the financial lever that will change the entire healthcare sector. Back to you, Supriya.
Sure. Thanks, Dr. Pankaj. That was, yes, definitely the financial lever is most important, and the reason why and how the industry can start adopting it. I think financial lever brings in a big, is the most important point there. Okay, so I think we've come to the end of the session, and I think we can take in questions if there are any on the Google Meet link that we have. So, yeah.
Thank you, Supriya and Dr. Pankaj. I mean, I would request both of you to join the Google Meet so that we can have interactive session there.
Sure. Thank you.
Sure. Thank you.
Thank you.